They used something called decayed missing and fill surfaces when they did their reanalysis, which is different than decayed missing and fill teeth. You can have 3 pinhole cavities in a tooth. You have 3 pinhole cavities in a tooth, and that comes with 3 decayed missing and fill surfaces. And then one tooth that's just about rotted on one surface completely will be one DMF, T, one decayed missing and fill tooth. So they were able, by means of that, pooling all the geographical areas, and I can tell you what areas of the country have high tooth decay rates, low tooth decay rates. Areas we've had improvement. In Louisiana, there has been no improvement in tooth decay over the last 30 years. It's just stayed rotten. Areas, would you be surprised that Palm Beach, Florida, is one of the lowest tooth decay rates in the country? It's not Florida, but do you wonder why? Or why, what's it called, that bedroom community in Maryland? I forget what the name is. Anne Arundel. No, it's a county area. Prince George's County, Maryland, which is a real affluent area. Florida, one of the lowest tooth decay rates in the United States. You can tell. You have a belt of decay-free people. It seems to follow a Bible belt almost. It depends a lot, and we discussed it in our paper here, what causes a reduction in tooth decay. We talk about it. It's diet. It's breastfeeding. It's at least associated with the very same social classes that have a better diet, that tend to breastfeed. We check with the Late J League. And believe it or not, it is better dental hygiene. Now, I didn't realize it until I started looking into the data, but dental hygiene supposedly among certain classes of people are better than they were 20, 30 years ago. But in areas where everything remains the same, tooth decay is just as rotten. We go into international studies as well, showing the reverse trends, showing that how in our country, while the upper middle class have probably the best teeth of all, in the developing countries, it's the lowest classes that have the best teeth of all, and the upper middle classes have the worst teeth. We look at their habits, their eating habits. In the developing countries, when you get richer, that means you can have candy bars. If you're poor, that means you have to eat the same old, folk foods and ethnic foods that they had before. So if we're asked, we point out that we have no proof, definitive proof of it, but it appears that diet, proper dental hygiene, breastfeeding, preferably for 6 months, almost total breastfeeding and nothing else, seem to be very positive towards good dental care. And we have the data to back it up. It's not fluoride. And what about fluoride in toothpaste? To get back to your question again, I would recommend, despite the fact that I'm willing to admit, say a 10 or 20% reduction, probably about 10 to 15% reduction in tooth decay, that because fluoride at 1,000 parts per million poses such a threat to periodontal tissue, that I would probably advise against it. Now my first daughter was probably my most, all my kids are fluoride-free kids. My first daughter left home at the age of 20 without a decay, missing, or failed tooth in her mouth, meaning she was totally decay-free at the age of 20. And that's, that's a statistic you don't get very much. Overall, in my family, tooth decay rate is extremely low. Again, we lived a fluoride-free family. We didn't have fluoride in our toothpaste. The idea of fluoride being a nutrient that's essential for good teeth has been disproven many times in levels. They've reduced fluoride in diets to as low as 5 parts per billion. That's 5 1,000ths of a part per million, with no difference in general health, dental health, weight gain. The thing is an out-and-out right fraud. And there's no question, it would be like me as a chemist. You're coming to me as a dentist and saying the periodic table of elements has been shown to be fraud. Oh my God, that's what I based everything I had. Sure, if you tell this to the dental community, it's real hard for them to accept. Because if they knew anything, forgetting about mercury being safe and everything, my God, if I don't know that fluoride is safe and effective, what do I know? Well, I'm quite sure I learned some things in dental school, and that they're worthwhile. You've got to realize that this is absolutely a fraud. That's all I can say about it. In 3 out of 4 court cases, we were able to show that fluoridation created a health hazard with regard to allergic type reactions, with regard to dental fluorosis, with regard to genetic damage, carcinogenicity. In one case, The judge himself said, even though I rule your way, I have to say I don't have jurisdiction. In another court case, the Supreme Court ruled against the lower court, saying, yes, fluoridation is harmful, but we don't have jurisdiction as a legislative function, which I think is a cop-out. Then in the case of Illinois, where the law was specifically there, that the Supreme Court couldn't get away that way, they went and actually contradicted the testimony of the witnesses. They said Dr. Yiamouyiannis and Burke admitted they had no background in statistics. And Burke was asked in cross-examination, when did you have your first course in statistics? He said 1928. He said before you were born. He's co-authored with 4 Nobel Prize winners, including David Young. He's the founder of the vitamin biotin, and every biochemist who goes through elementary biochemistry knows of the Line-Weaver-Burke enzyme kinetics. He is the Burke of Line-Weaver-Burke enzyme kinetics. This is my co-author. I'm not dealing with low-caliber people here. These are top people. And we were able to show. And he went through his thing, and I said, I was asked during testimony, how about you, Dr. Yiamouyiannis? Well, in graduate school, I majored in biochemistry, got my PhD, and I minored in mathematics with a major within that minor of statistics and probability, taking stochastic processes. Told about my own epidemiological studies. The Supreme Court comes and writes, Doctors Burke and Yiamouyiannis admitted they had no background in statistics. Okay. And a number of other, they said, and the judge did not say he was convinced that fluoride was harmful, and that's exactly what the judge said in his decree. He was absolutely convinced, that the evidence had been brought up showing this and this and this. Exactly the opposite. And then we said to ourselves, how can the Supreme Court be so crooked? Now we since realized that there was a Gray Lord Commission there, which found about 150 judges guilty of something, or the Supreme Court let them off. And here's the kicker. Peter Spikas, who is the chief counsel for the American Dental Association, is also chairman of the ethics committee of the Illinois Supreme Court.
Yes. It's called politics.
It's called politics. And if we're going to have things that way, if we can't use the court system, and the political system is pretty bad as it is, because the Dental Association carries a lot of weight. It carries a lot of weight in Congress. The American Medical Association does too, but I'm surprised the American Dental Association. It carries a lot of weight within the state legislature. And what we have got to do is understand where our enemy is. We get rid of fluoridation, and then we hold this ADA press release out and saying, here's what it says, and saying some of the same things. Let me read a little bit from it. Water fluoridation remains the safest. I get a kick out of it. Every time I get a chuckle. It's like reading jokes in Reader's Digest. Water fluoridation remains the safest, most effective, and most economic public health measure to prevent tooth decay and to improve oral health for a lifetime, according to American Dental Association. This will give you a good example, I think, of the way we deal with these misconstructions. You got to remember, the NTP studies still haven't come out completely. They're still coming out.
That's January 1, 1990, right?
This is January 29th, 1990. This reaffirmation of support for water fluoridation comes in the face of preliminary data from a study conducted by the National Toxicology Program. In this study, some rodents developed bone cancer after drinking water containing sodium chloride. The ADA, however, emphasizes that no connection should be made between the preliminary results or that study and the likelihood of humans developing bone cancer by ingesting fluoride. The amount of sodium fluoride given the rodents in the study far exceeded the optimal level of fluoride present in drinking water, 1 part per million. We'll get to that later because we have a press release that came out after this. In the NTP study, 1 rat among a group of 50 developed bone cancer after ingesting 45 parts per million fluoride over 2 years. The average life expectancy of a rodent, well, they don't know too much about animals because a rat lives for 5 years, and the bone cancer was found in rats, this particular rodent. It wasn't life expectancy. While bone cancer appeared in 4 rats in another group after they drank 79 parts per million fluoride over the same period of time. They didn't point out, by the way, that there were no bone cancers in the control, and furthermore, that the historic rate of bone cancer is something like 0.007% for rats. Now, these are little bits of information that I'll give you. On average, a person ingests 8 8-ounce glasses of water a day. Now, here the mathematics fall apart. New England Journal of Medicine, ADA, and so forth. I think they must leave this to their, to some secretary to do the adding or something. No comments. The secretary is probably a better addition abilities than these. So figure this, on average, a person ingests 8-ounce glasses of water a day. A person would have to consume 388-ounce glasses a day to obtain 45 parts per million fluoride. Well, you could drink 17 bathtubfuls of 1 part per million fluoride and you'll never obtain 45 parts per million. You don't add parts per million together by glasses. It's a concentration. They don't know what the total dose was, so they really can't even equilibrate it. But if you take a look at their addition and so forth, 380 does not equal 88-ounce glasses a day up to 45 parts per million. And nearly 700 glasses daily for 79 parts per million. Quote, "It is totally inappropriate to draw any conclusions from this single study or to suggest that it is applicable to human beings," unquote, said Dr. Enid Neidl, Director of Scientific Affairs of the ADA. Quote, "The ADA wants to allay any concerns people might have about drinking fluoridated water as a result of these limited study findings." They want to what? Allay the concern of people? They want them to forget about it is what they want to do. There is a substantial scientific evidence supporting the benefits and safety of fluoridated water for humans. They're coming off their title, which is, the safest and most effective. Now they're down to, when you get to reading it, now there's substantial evidence. Okay. Indeed, numerous studies have shown the consumption of fluoride in community water supplies at the level recommended for optimal dental health has no harmful effect on humans. Well, I agree with that entirely. There shouldn't, obviously, the amount of fluoride needed for optimal dental health will not cause any harmful problems. And the optimal level is probably as low as possible. Studies conducted by the National Cancer Institute over a number of years have shown no correlation between fluoridation and cancer. These were the studies, by the way, where they made the error, left out 90% of the data. During the SEER study conducted by the NCI during each year from 1973 to 1987, the bone cancer rate among people remained steady, neither increasing or declining. Does that mean that our methods of treating cancer are ineffective altogether? From 73 to 87, they made no advances in bone cancer, what they're saying. Or if they did make advances, then obviously it should have gone up if they hadn't made advances. But that's not in here either. And the bone cancer thing is just a ruse anyhow, because it's not just bone cancer that's caused by fluoride. The bone cancer of the rodent scot in the NTP study is rare among humans and accounts for less than 0.01% of the 1.1 million cancers diagnosed each year. Again, they're off by an order of magnitude. It's 0.1%. Not that it makes any difference, but it shows not only is their logic wrong, their mathematics is wrong. The ADA has firmly supported community water fluoridation since 1950. Based on its continuing evaluation of the safety and efficacy of fluoridation, a total of 80 national and international organizations endorse or support water fluoridation, including the World Health Organization, the American Medical Association, and the U.S. Environmental Protection Agency, period, which I might add parenthetically, has denied they have ever endorsed fluoridation. The effectiveness of water fluoridation has been documented in approximately 140 from studies from 200 different countries over a period of several decades. The data from these studies have continually shown that children living in communities with fluoride-adjusted water experience an average reduction in tooth decay rate in the range of 17 to 40%. Now, if you take a look at that CNE News article, it's the back of the Medical Tribune article, the last paragraph, somebody read that. This is an ADA spokesman saying this in December or last year. Somebody read that?
When asked by CNE News, a spokesman for the American Dental Association said that ADA believes that water fluoridation can reduce tooth decay 18 to 25%.
Okay. Now it's good. Okay. I'll continue on.
As recently as 1988, the association claimed fluoridation reduces decay 40 to 60%.
Okay. It used to be 65%, then it went 40 to 60%. As of May of 88 to 89, it was down to 17 to 25%. Then the cancer data came out. And since it came out that fluoride may cause cancer, or is carcinogenic, they pushed the 18 to 25 to 17 to 40%. Because they feared that if they stuck with the 18 to 25%, people say that's not worth the risk of cancer. So you see how they have their, there's no science there. We're just talking about pure politicians, excuse the vulgar terminology, but save your you-know-what politicians. And then page 4 on the press release. Fluoridation can also benefit the adult in 2 ways. The first is through the remineralization process, in which beginning carious lesions in the enamel fail to enlarge or reverse because of frequent exposure to small amounts of fluoride, which has never been shown. When you compare 1 part per million fluoride in the water versus the 1,000 parts per million you have in toothpaste, there's no question that you're not going to get any remineralization effect from 1 part per million. The other protective effect is the prevention of root caries. There's one study, one poor study with a handful of people, a progressive erosion of root surface affecting adults with gingival recession. Studies have demonstrated that fluoride is incorporated into the structure of the root surface, making it more resistant to decay should it be exposed as a result of gum line recession. The annual cost of community water fluoridation averages only 35 to 40 cents per person in the United States. With the escalating costs of health care, fluoride remains a preventive measure that benefits all members of the community at minimal cost. In addition, the need for restorative dental care is lower in fluoridated communities, which is not true. It is estimated that every dollar invested in fluoridation saves about $50 in dental expenditures. If you take a look at the book Fluoride, the Aging Factor, at the last page, I think it is, of chapter 14, I have a list of the 10 most fluoridated and 10 least fluoridated states. That's where I went to the American Dental Association to get the data, showing no difference in dental care costs, whether fluoridated or not. Now, compared to that, I'll tell you, let me just go over our press release if I can find it quickly and show you the difference. Hope I can. Yeah, here it is. Ours is 2 pages instead of 4 pages, and it gives you a little bit of history. Some is repetition, but it goes into just about everything they go into, and hopefully it'll clear it. In studies showing fluoridation linked to 10,000 cancer deaths yearly confirmed by U.S. Public Health Service study. In 1977, epidemiological studies by Dr. Dean Burke, former head of the U.S. National Cancer Institute's cytochemistry section, and Dr. John Yiamouyiannis, president of the Safe Water Foundation, showed that fluoridation is linked to about 10,000 excess cancer deaths yearly. As a result of these studies, Congress mandated that animal studies be conducted to find out whether fluoridation is carcinogenic. In other words, our study came first. They weren't quite sure, I mean, maybe, despite the fact we control for many things, age, race, sex, and population density, and a number of things, it might still be that, we're looking at something else. Certainly, it should be shown that fluoride is carcinogenic. Well, in 1984, Japanese investigators showed simply by exposure to fluoride they could transform normal cells to cancer cells. I mentioned some of the other studies. But they commissioned the National Toxicology Program of the United States Public Health Service to do these studies. These tests were designed to determine whether or not water fluoridation results in an increase in human cancer risk. They were conducted by the National Toxicology Program, which is called NTP, under the auspices of the U.S. Public Health Service, a leading promoter of fluoridation. The NTP test showed that fluoride is carcinogenic. Fluoride caused bone cancer and increased the rate of oral cancer. However, the NTP studies were not the first animal studies to show that fluoride is carcinogenic. Research from St. Louis University, the Nippon Dental College, and the University of Texas showed that fluoride has the ability to induce tumors, cancers, and stimulate tumor growth rate. Late last year, the Safe Water Foundation obtained, quote, carcinogenicity studies with sodium fluoride performed by Procter & Gamble, and the quote is from the Public Health Service, which had been submitted to but covered up by the United States Public Health Service for 4 years. Dose-dependent increases were observed in every parameter tested. These results will be appearing in the next issue of Medical Tribune, so if you can get a copy of it. I mean, I can't give it to you now because it's not out yet. It's a beautiful article. For some reason or other, I get knowledge of these articles before they come out because it read to me over the telephone, yes.
About safe water, we've been looking for an expert on water. Someone knows about oxidation reduction potentials, resistivity, conductivity, all of that. Is there anyone that you would feel is an expert or well-grounded, knowledgeable, to show how water plays the role in physiological, biological processes?
Sure. I mean, I or any other biochemist who has, halfway decent credentials. I mean, redox potentials and all that type of thing have been big things with me. As a matter of fact, in some of these early studies that were done with fluoride, naturally fluoridated areas, I haven't looked at it, but I will bet you that in some of the areas where there was low tooth decay, if it was due to the water, it was due to the fact that the water had a high buffer capacity with a pH of about 9 or 10. I mean, it's very alkaline. So if any acid were formed in the teeth, it would have wiped it out. And that might have been related to higher fluoride concentrations in the water. People don't think of sodium chloride, but sodium chloride is a base, and so is calcium chloride. The chloride ion actually hugs on to hydrogen ions and might tend to make it more alkaline, but that's not enough. I think there was a strong buffer capacity in this water.
Let me ask you a question. Are you familiar with Ralph Steinman's work?
No. No, I'm not.
Well, there's a book out there. Maybe you'd like to read
Sure.
it. And,
The thing, to be grounded in a field is fine. It doesn't mean that I know every study that's been done on it. Yeah.
What about the effect of these high alkalinity areas in relationships to cancer?
I don't know about that, but I do know as far as the mouth goes, I have a feeling, and maybe the dentist in this room could verify it, I have a feeling that the higher the alkalinity goes, the more likely you are to have tartar buildup in the mouth. Is that true? No?
I don't know.
To a degree,
Pardon?
to a degree, it depends upon the
Because calcium-
imbalance between calcium and phosphorus.
Yeah.
What we're talking about is, I've heard it said that the fluoride ties up the iodine that's available for the thyroid, so you get a net low hypofunctioning thyroid function because of it.
The relationship between fluoride and iodine, I believe, is more due to the fact that fluoride is an enzyme inhibitor and stops the incorporation of iodine into thyroxine and thiamine. Let me just get back to the second page of this, and then, under the congressional mandate, the NTP study had an estimated cost of $10 million, was designed to determine whether water fluoridation results in higher cancer death rates in humans as found in the Yiamouyiannis study. Higher doses of fluoride were given to compensate. Now this is important, because this gets to the point that they were getting at. And this was how the study was designed, before the results ever came. Higher doses of fluoride were given to compensate for the limited number of animals used and the relatively short time of their exposure to fluoride. This is always done. They used somewhere around 50 animals in each group, which is not a large number. They were finding, 5–10%, of the animals had cancer. Types of cancer which they would never have before. So far, the NTP study has shown that fluoride causes bone cancer, increases rate of oral cancer in rats. The types of cancer caused by a substance like fluoride in the rat may be entirely different than the types of cancer caused by the same substance in humans. And this is absolutely true. In other words, if we found cancer in their tail, we shouldn't go around looking for a cancer in the tail of humans. The fact is that it's carcinogenic is the important thing. And I can tell you physiologically why cells which extrude collagen or collagen-like proteins are more sensitive to whammy doses of fluoride than other cells in our bodies which would take a longer exposure at lower doses. The main point is that fluoride is a carcinogen and that the Yiamouyiannis study showing a link between fluoridation and cancer has been confirmed. The mode of action by which fluoride appears to work is through its interference with DNA repair and or synthesis, processes which are carried on in every cell. Therefore, there is no reason to believe that fluoride's cancer-causing abilities will be confined to one particular cell type. And then I go through the tooth decay data, just one paragraph, of tooth decay data that we just dealt with. And that's how we handle things like this. This has been sent out to every major wire service and every television station in the major market areas of the country and every major newspaper in the country.
How does the fluoride affect the fibroblasts of the ground system?
Okay, what happens is, and it's in chapter 4 of my book, how fluoride interferes with we don't know what's happening inside the cell because the studies haven't even been done on the cell during collagen or melogenin biosynthesis. But we do know, once this stuff is extruded, that the chemical nature of the collagen or melogenin or collagen-like proteins, like the classified as collagen-like proteins, I'm going to talk about fibroblasts, chondroblasts, ameloblasts, abdominoblasts, and osteoblasts, and so forth. But there are a number of cells that are responsible for manufacture of enamel and dentin and bone and ligaments and tendons and cartilage that extrude proteins out of the cell. And in normal circumstances, they are subtly different. The way they're calcified, if they're calcified at all, will be different depending on the cell type that gives rise to the extrudate. I mean, you have a cell here that's manufacturing stuff and just sort of streaming it down like a net. And what happens is, in teeth, the reason you have these white chalky areas is you have areas of the teeth because the imperfect way in which the collagen-type protein has been made, that you have overcalcification in certain parts and undercalcification in other parts. And because of these inconsistencies, rather than getting the pearly white, you get the chalky white. You get the same thing in bones. You get osteoid, non-calcified seams through bones as a result of fluoride in the water supply. We're talking about 1 part per million now. We're talking about experimental animals being fed not even 45, but 1 part per million. We're finding hydroxyproline and hydroxylysine, characteristic of collagen and collagen-type proteins, increasing in the urine, because these things are just being hydrolyzed away, or bits and pieces are being hydrolyzed because they're not part of the whole structure. And you have ligaments and tendons, you have calcification. In the chondrocytes that excrete the cartilage on the bone surfaces, or the joint surfaces, you get calcification. You get calcification of ligaments and tendons. And of course, what you do is you get osteoarthritis as a result. In addition, if the damage is not enough to quite cause calcification in tissues that shouldn't become calcified, the change in protein structure as a result of the interference of fluoride on the cells causes a protein to be extruded that is no longer recognized by the body as being the body's own protein, and what results?
Allergy, rejection.
Allergy, autoimmune response called rheumatoid arthritis. And these things, I mean, I'm just touching the surface on what fluoride does. When you put a substance into the water supply that at 1 part per million inhibits 10 enzymes that we know of and probably another 90 that we don't know of, we've got problems. Fluoride at 1 part per million, as I mentioned before, inhibits the enzyme, the DNA repair enzyme by 50%. It depresses the immune system by 30 to 70%, the polymorphonucleosides, in 2 ways. Their ability of a white blood cell to get to its site is dependent on 2 things: the bloodstream, which takes that white blood cell, and finally chemotactic, due to a chemotactic factor, it will clump onto the side of the blood vessel wall, and then it will squeeze through like an amoeba and get to that particular place. Fluoride has been shown to decrease the white blood's ability at 1 part per million, white blood's ability to go through by 30 to 70%. So you slow down the immune system's response to infection, cancer, or whatever it happens to be. Then when the white blood cell finally gets to the guy and engulfs, it normally will do 2 things. It'll form a vacuole around whatever it has to consume, secrete lysozymes in there, a bunch of enzymes which will digest this, and then it gives it the final whammy, the superoxide, to just pulverize whatever is left. Instead, when you drink 1 part per million fluoride, and at even lower levels of fluoride in the bloodstream, the white blood cells that have this, how should I say, they're carrying a revolver in their pocket, you know, they put something in there, they put a rabbit inside there and shoot it, and then they just keep it inside and then just digest it away, and away it goes. Instead of that happening, fluoride influences white blood cells to the point that they leak superoxide out continually. Of course, as this causes damage, one of the reasons called the aging factor, causes damage to the rest of the body, destroying the body instead of the rabbit in the vest. It's probably a bad analogy, though. You probably shoot yourself with a rabbit in your vest. But, I mean, that's the way it works. Our bodies work with compartments. There are things in certain compartments of our body, if we ate them, would be deadly. In addition to that, because the superoxide has been wasted, secreted into the surrounding medium, it has actually been found that when these white blood cells have to destroy something, their ability to do it is less because they don't have enough superoxide reserve left over to properly do the job. So not only does it take it longer to get there, but it takes it longer to do the job because it's used a number of its bullets. In other words, if I couldn't get it the first bullet, I shoot a second bullet to that rabbit. So, I gotta come up with something else. I came up with this program. I think of some other analogy, but anyhow, it's wasted its resources in destroying the body, and now doesn't have the resources it needs within itself to do as good a job as it could have before. In court, when we brought this up in a Scottish court case, the other side said, yeah, but that's true in animals, but how about humans? Do you have any epidemiological data? Well, we didn't, and the AIDS thing came up. And I don't want to get in the AIDS thing at all, for the simple reason there's been so much garbage about AIDS. I could spend one day just talking about AIDS. And I don't want to. I will tell you one thing. We did look at the data. There's a fellow, what's that guy's name up at UC Berkeley?
Yeah.
Duesenberg.
You've got to read his article in
Non-HIV.
Yeah, on the Proceedings of the National Academy of Science. Excellent article.
Does he still have a link to that view?
Oh yeah. And there's a book out now called HIV, the cancer, the AIDS myth. HIV, the AIDS myth.
Is there research now to back him up?
Yeah, there's been one recent piece of research now where a virus has actually been found, where when reinjected into animals does cause AIDS. I mean, there's so many arguments against that. But what we wanted to find out was this. I felt Duesenberg was right. So we went to the went to the Public Health Service again, you know, information please, and asked them to supply us with a number of people who died from AIDS in 1987 and 1988. Well, they gave us the 87 data, and I had to twist arms to get the 88 data. It confirmed what I thought, and this is one place where Burke and I differed. He thought AIDS was going to take off, and I said AIDS is going to be over by the later part of the 80s. In 1987, 12,800 and some odd people died of AIDS. In 1988, about 11,000 died of AIDS. And if we don't use AZT, AIDS will be on its way out. If we use AZT, I've been talking to Duesenberg on this, AIDS will become a self-fulfilling prophecy because AZT is a strong immunosuppressant.
And we make that compulsory. If you test with the antibody, you know.
And the other thing about the antibody test, yeah. If they make it compulsory, well, of course, then again, they have to make the antibody test compulsory. I would definitely recommend nobody take the antibody test. But anyhow, that's that's just a difference. How did I get to that again? Oh, the immune system. That's right. Oh, yeah. Let me finish up my point. I almost lost my point. My point was, so we went ahead and looked at AIDS levels in fluoridated and non-fluoridated areas, and they're 3 times as high in fluoridated versus non-fluoridated areas. That is not really significant. I'll tell you why. Because what may be diagnosed in AIDS in one area will not be diagnosed in AIDS in another area. But at least what it did was confirm the possibility of what we're seeing in animals does have an important effect in humans. There are a lot of other immunosuppressants, by the way, cortisone, that can do exactly the same thing. Butyl nitrate has been associated with it and so forth, yes.
You get off on this. Could you explain your hypothesis about AIDS, that it would be over by itself? What do you?
Well, very, very simple.
Okay.
I think AIDS, and it may come back again, but I believe the first cases of AIDS, of course, were reported, probably in the early 1900s. They weren't called AIDS at the time. I mean, we all remember seeing when we were kids on TV, when TV first came out, when I was a kid, it first came out. These stories about this poor kid who had to be wrapped up in this bubble chamber because his immune system was down. If he got out, he would die. Basically, what? AIDS. Okay. His immune system was down to nothing. Anything you do to your body that's going to reduce the immune system is going to have the same effect. It's going to give you the same, you have diagnosis as pneumonia, and so it means your immune system is down. AIDS shouldn't even be used anymore. It stands for acquired immune deficiency syndrome. And syndrome is just a list of symptoms. What we're talking about is immune deficiency. Acquired, what does it mean? You got it from somewhere. Well, that's I'm sure you got it from somewhere.
Oh, but it implies the HIV is a causative agent.
No, it doesn't.
Well, I mean, when people talk about it, it's their understanding of it. I had a course recently on psychoneuroimmunology,
Right.
somebody at UCLA, and she talked about it, and I raised a question about how about HIV, how about AIDS being caused non-HIV AIDS?
Yeah.
And I was embarrassed to be in the room when she got through with me. It was like, where are you from? This is totally unacceptable, unacceptable. So that's why I'm saying when they talk about AIDS, they mean HIV as a causative agent of AIDS in general. And what you're saying is that, what are you saying about HIV?
I think HIV is like Epstein-Barr, it's like cytomegalovirus, a bunch of viruses that float around in our body continually. Depending on our immune system, they may or may not. Pardon?
It's an opportunistic.
It's an opportunistic virus, that's all.
Okay. So what is the real cause of what we call this epidemic
Well,
that you
that's
think
what I
would
was
be
getting to.
okay.
Basically, I think that what happened is our lifestyle, in some cases, got so atrocious. In the sense, I'm not talking about morally. They talk about, you have some fundamentalists saying, this is God's curse on the homosexuals. Well, lesbians are probably one of the most risk-free groups going. I mean, it's not a curse on homosexuals. It might be a curse on male homosexuals. I don't know. But it certainly is not a curse on homosexuals. Our lifestyles have gotten so bad as far as sleep, as far as diet, as far as a number of things. And there, by the way, there have been homosexuals living together, cohabiting where one had AIDS, one didn't, and they were involved in sexual relations. I got this from stonewalling. What happens is a certain segment of our population had lifestyles so pathetic as far as diet, sleep, exercise, environmental health, exposures, mental attitude, that they became susceptible to their immune system was so low, they became susceptible to what you call opportunistic viruses. And we basically, I hate to say this because it sounds almost genocidal, nature cleaned out that segment. And as it cleaned out more and more of that segment, the number of those people would go down.
And it's
So-
not spreading that segment? Are people taking better care of themselves, or?
No, they just cleaned out. And maybe they're taking better care of themselves now, but those people who had all these horrible health practices, and they didn't have to be homosexuals to have bad health practices, were weeded out, they were cleaned out. It was a basic natural selection process. And Burke was saying, no, it's gonna go up, and I said, no, it's gonna go down. Unless we have more and more people, acquiring these horrible health practices. We could have had a so-called AIDS epidemic in the Dark Ages. We wouldn't have known it was an AIDS epidemic anyhow.
Right. I'm really shocked by your statistics, that it's less than 88 than 87.
Well, it's not mine, it's CDC's.
I understand, but.
I expected it.
I know, I understand you did, but that seems so contrary to the normal inputs that I get about AIDS, of, it's gonna wipe out all the insurance companies and medical benefits, et cetera.
I wish it would wipe out the
So
insurance.
that's height, so that they can engender tax money to play with.
Exactly.
It's a game. It's a.
What is the ADA's investment in supporting and standing behind their theory about fluoridation?
It's called reputation.
What would be irreputable about changing one's mind based on reasonable information?
You ever see a referee change
Well,
his
you
mind?
gotta remember,
They're
they are
oriental in
working,
that respect.
yeah,
They
they are
gotta
working,
commit suicide.
there's no question about
They don't
it.
intend to do it.
How much
You know,
are
while many of us might be willing at this stage to change our mind, ADA, how should I say, being that dinosaur that can't move, is handicapped in a way. They can't. Even for their own self-preservation, they can't. They're so used to raw power that they feel that they may prevail. Quite frankly, if we don't have funding, if we don't get the thing out to the public, they could prevail just by the power that they have. And that's what they're going on right now. But I think they're going to see this thing through to the end. They're going to go down, with a stake in their heart, hopefully. I just soon have it this way. For a while there, I was thinking, we'll get together with the ADA and say, okay, but let bygones be bygones. We'll just let you do all your other nasty things with the mercury and so forth. I said, no, let's really screw them to the wall now, huh? Let's really get them. I want to get them now. I mean, I won't even let them get out. Yeah.
Okay, what occurs to me is what I'm doing in my office, which is other applications of concentrated fluoride that is a lot worse than the toothpaste or even the topical fluoride we put on kids' teeth.
15,000 parts per million.
Right, where we put in even the glass ionomer fillings and cements, which are now broadly being used, are being touted as beneficial because of a low level of fluoride release around the margin of the filling, thereby protecting those teeth. Now, it's my impression from the literature and the lecturers that that is a tremendous benefit, and there are, especially around the gum line in the cementum, where people are decay prone, you put this stuff in versus non-fluoride releasing material, and you've got a great benefit there. Okay, so restorative materials are impacted by this statement, and I would like you to comment on the topical fluorides that we put on. Also, what percentage of the real concentrated ones for
15,000.
dental sensitivity?
Oh, for dental sensitivity? I don't know what
Yeah,
that is.
we spot place those. Those are probably several percent.
You know how they work, don't you?
I don't know how they work.
Well, I'll tell you how they work first.
Do they work?
They do work.
Okay.
I'll tell you how they work. What
Okay.
happens is you have dental tubules. I don't have to.
Right.
You know the anatomy better than
Yeah.
I do. What they do is they soak up there and they precipitate out with calcium to form calcium chloride and block the tubules.
Okay.
So it stops the sensitivity.
Okay, now, are those also causing systemic problems of the nature that you're referring to with the enzyme inhibition, et cetera? Do they leach
Locally,
in?
they will. A little bit will get into the bloodstream.
Yeah. Sufficient to make a noise about?
Sufficient to make a noise about?
Yeah, are you gonna go?
Well, I mean, I don't know. Is
When
mercury?
you're
Is
done with
mercury?
water, are you gonna go into these other things?
Is mercury harmful?
No, I'm not. I'm not.
Why not?
I mean, as far as that goes, I'm not going to do it. If you ask me whether to do it, I'm going to say, as you have a risk of poisoning a person for mercury by using mercury fillings,
Sure.
you're going to have a chance of poisoning your patient from the fluoride.
Right.
And it'll be more in the initial rather than what you have with mercury. Mercury is a continual release. In this one, it'll be the initial whammy dose of fluoride that you give them will cause gum damage and get into their bloodstream. After a while, once the dental tubules are cemented in with fluoride, the amount of fluoride released from there, unlike mercury, will not be the problem. It's the initial treatment.
Unless you put it in the restorative material where it's
Okay.
continually leaching out.
There you might have a problem,
Yeah, similar to the mercury.
similar to the mercury.
Now, what a guy like me is doing, I'm taking out mercury and I'm putting in fluoride. You understand? I'm doing that
Yeah.
now.
Comes the dawn, you know?
Well, all I can say is this. You know, again, I don't know what the permeability of the fluoride is through the ionomer. Is the fluoride in touch with the tooth? You have a tooth, I don't know, you have a cavity here,
I want to help you out with this.
which you fix.
Well, you haven't been around, so you don't know this, but you gotta look at Ralph Steinman's work. You know that when you have certain substances, you reverse the flow in the dental tubules.
Right.
That's when it gets worse. And this applies also to metal ion transport, also applies to electrical charges and currents generated from dissimilar metals in the mouth. But we won't get into that one. It's great to see young dentists come in and realize that what he's doing might not be beneficial to the patient and actually might be harming him. When you look at it thoroughly in all aspects, you'll realize dentistry is a tragic mistake. Okay?
99%.
99%. In other words, we really have to get serious about preventing this.
This sounds like
We
a
have to
Shakespeare's
make
here.
We have to make it a national priority. And you're not the first one, but it's like come to dawn again, but you realize, oh my God, what am I doing? You know, on one point, a practical point, is that the Clinical Research Associates did the fluoride release thing for cavity liners. And Cavalite came out the worst, so that's the one you want to use. In other words, as far as
What
I am
about
released.
these, like the Key-Tac fill, those kind of things for cervical erosions, or even Key-Tac silver for rebuilding, post-build-up, stuff like that? Have they studied that, you know?
Well, I don't know about that particularly, but all of
It's
the,
very
all of
commonly
the
used.
ones with metal ions, you gotta understand that the tooth is a totally open system. What we look at, we see the outline, the cement and the root, the periodontal ligament and all that. That's all just one continuum. It might as well just be cheesecloth.
Cortical bone.
You know, it's just wide open, so it doesn't make any difference. Anything that you put in that tooth is a toxic scar. And how are you gonna deal with that? It stops energy flow, does all kinds of things. And they're not even discussing that. They're trying to say, well, procedure number we're gonna pay so much for, you know. They're not even discussing the merits of their treatments. And then they're sticking to last century's ideas. I don't know. The whole thing, we gotta shake it down.
Well, I mean, there are ionomers that are made without fluoride, right?
No.
No.
None.
No.
And you're broadening the statement to anything we put in the tooth.
That's right.
Any restorative material is bad news.
And what they
Is that
talk
you're
about
saying?
is they talk about benefit to risk ratio, just like here.
Yeah.
And where the dentist takes all the benefit and the patient takes all the risk.
Is that what's happening here?
That's
I mean,
what's happening.
No, okay, let's talk about restorative dentistry now. Talking about any material. Okay, am I hearing you say that the benefit to the patient is greater than, I mean, is less than the risk to the patient, no matter what the material is?
No, you have to weigh it, and you have to
Okay.
tell the patient that everything that you do for them is a compromise.
Right.
But because you've got a situation that's already compromised when it comes into you.
Right.
And you've got to make some kind of semblance of treatment to reduce the stress in there. And that's what it equates. In other words, dentistry is a great stressor to the immune system. It's a great stressor to the body.
Okay, let me put this in context of the chemical aspects of it. Do you know what the concentrations of fluoride are in these things?
I don't know.
Is it all the way through or just on the?
All the way, it's in the material.
It's in the material.
The ionomer itself is part fluoride.
It's real concentrated, like maybe 14 to 17 parts per million.
17 parts per million?
Yeah. it's
That's
real
all?
high.
Fluoric acid.
Are you talking in the
In the
restorative
cements,
material?
like in your
Yeah,
lining
okay.
If
cements.
that's all, let me tell you something, that's less than the concentration in your bones and teeth. If you don't, you know, if you live a low fluoride diet, real low fluoride diet,
You're safe.
you will have in your bones, at my age, maybe 200 to 400 parts per million fluoride. Because bone will just pick up fluoride.
Well, we have
how many
natural
parts per
fluoride.
million?
200 to 400 parts per million in the bone.
200 to 400.
In the bone.
Yeah. Okay?
Not in the soft tissue.
Right, naturally occurring fluoride in the bone.
And it'll be locked up in the form of, and if I take bone meal, if I take 200 to 400 parts per million fluoride in bone meal and swallow it, as some people take bone meal for a supplement, I will actually have, in the bone meal that comes through my body, will actually pull more fluoride out because it has such a high affinity for fluoride. It'll lock it up and pull it out. So if I take bone meal with 200 to 400 parts per million fluoride, some of the bone meal that comes through will come out with maybe 1,500 parts per million.
So they clean fluoride out of water, right?
That's one of the ways they clean fluoride out of water.
Is that damaging for people?
What?
To eat that?
No, no,
Okay.
the bone meal you don't want to get is bone meal, you know, from some rotten herd that was sitting downwind from a phosphate fertilizer plant that has 5,000 or 6,000 parts per million. Even then, the bone has such a high affinity for the fluoride that it will not remove, that will not really give much fluoride. But if you take fluoride in the form of the ion itself, where it goes right in, you know, then you got a problem. Here, as I was looking at it, you have, if I knew exactly how much fluoride there was, if it's 14 to, what's it, 14 to 17 parts per million, I wouldn't worry about it myself at all. And if anybody should worry about fluoride, it's me. Because here you have tooth. You have tooth that has 200 to 400 parts per million in it, okay? You have 14 to 17 parts per million in here. If anything, and there's any movement at all, it'll probably be more in that direction than in that direction.
Yeah, that's right.
And this is tightly bound. Once, I don't know what the circulation is to the dentin. I'm not a dental person. I'm really at a loss here. But I will tell you within the bone here, or the dentin here. God, I wish I had a dentist here doing this. That the fluoride should be pretty locked up. And the small amount, if this is 14 to 17 parts per million, I wouldn't worry about it at all. I would imagine it'd be more like 1,400 parts per million.
I think they
14,000
measured
parts.
it, and I think the cavalite was something like 1.2 parts per million released or something. They measured the release of these things, and they said this was the worst one. So that's the one you want to use.
You mean the least release?
Yeah.
Yeah. But he's saying that's a drop in the bucket compared to what's naturally in
Now,
the mouth.
he's saying 1.2 parts per million released.
Yeah.
I'm saying 14 parts per million total. Released over what period of time?
Well, every time they did the study, I don't know. I just
Was it
remember
part per
going
million?
through that. Because we've been talking about,
Yeah.
we'd like to find one that had no fluoride in it.
Or, I'll tell you what, if you could, get back to me with the concentrations of
That'd be a
fluoride
good idea.
All right, yeah.
in the medium, and I'll give you an opinion on it. I would say, as long as if it's 200 to 400 parts per million or lower, I really wouldn't worry about it. But if they're putting enough in there to so-called prevent bacterial buildup over here, I'll make you bet you
That
thought.
was not the purpose of it.
Oh, was it?
That happened to be a fortuitous side benefit.
How did they find it was a side benefit?
Well, they discovered that it releases fluoride, so they associated it with the...
Well, but the point is, it's a circular argument.
I understand.
Did they ever find that it was better with a high fluoride ionomer than low fluoride ionomer?
I don't know whether they
If they
studied
didn't
it
do
or
that,
not.
you have no proof that it does anything. If it doesn't supposedly do anything, chances are there's no fluoride in
They
there.
were using it as an argument to use it, because everybody
That's
believes
all.
fluoride.
Clinically speaking.
It's not a very scientific
It's
argument.
just to buy,
Right, I
one of the
understand.
main
It's
reasons.
taking, okay.
It's a side benefit type thing.
Yeah, yes, in the back.
What about the combination of aluminum with fluoride in drinking water and the connection of that to the ease through the blood-brain barrier for Alzheimer's?
It's a possibility, but you have to prove to me for sure. And I saw it was last year for the first time I saw one study that might reasonably indicate that aluminum causes Alzheimer's disease. Every other study I've seen has just shown that in Alzheimer's patients, the brain concentrations of aluminum is higher, which to me is no indication that aluminum causes Alzheimer's disease. I think we're far, far away. I mean, it's not quite as bad as the HIV/AIDS connection, but it's close to it. Just because you find high cholesterol in a person's blood who tends to be more likely to have heart disease doesn't mean that the cholesterol is causing it. Just because you have a lot of aluminum in the brain of Alzheimer's patients doesn't mean it's what do they call it, circumstantial evidence. But if Alzheimer's patients' blood-brain barrier breaks down as a result of some other effect on the brain or some other degenerative condition of the brain, it's not surprising that you'll have higher levels of aluminum or maybe other things that would otherwise be kept out of the brain. There was one study last year, and I can't remember the details of it, that finally indicated aluminum may be implicated as a cause of Alzheimer's disease. Now, with regard to fluoride, fluoride does complex aluminum, and I had one crazy person who was think a psychiatrist or something like this at Ohio State University, was giving high dose levels of fluoride to pull aluminum out of the brain. Thought it would pull aluminum out of the brain. He was using levels so high that it was acutely toxic. And I think he finally gave up after a couple of patients weren't killing too bad. I don't think, I don't think it's a good drug against it. I don't know whether this combination with aluminum would make it go through, but it does form a complex with fluoride. There's no question about that. And aluminum oxide is another way of removing fluoride from the water. They pack aluminum oxide in a column and run naturally fluoridated water through it, and the aluminum oxide will pick the fluoride out. Yeah. Oh, I'm sorry. Yes.
Okay, may I ask you about concerns of drinking water? What is there, first of all, can you comment on deionized water, whether that's healthy to drink over a long period of time? And secondly, if you know of a filtering system that is excellent,
Yes.
long-term, not having the side effects we hear about with the microbial infiltration. Those two things, I really appreciate comments.
Well, we'll do the second. Well, give it to one at a time.
Deionized water first.
Deionized water
Is that
first.
the best way to have clean drinking water?
I don't know if there is. If there is a best way to have.
Or is it acceptable? Is it
It's an
healthy?
acceptable way. Yes.
You can't go wrong drinking deionized water for
Well, it depends
years.
what you use to deionize it with.
Well, you have a little deionization thing, just like in the lab.
Well, I'm just
You
saying,
boil
but
the water and you
but
collect it on
there,
your
I
own.
mean, there are different things. Like there are different fillings. I mean, it's like me asking you, are fillings good for teeth? You ask me, well, what kind of fillings? Silver mercury or glass ionomers or composite and so forth and so on. I'm asking, what do you want to put this water through? If you want to put this water through a cheap, deionizing resin, it won't take out fluoride.
No, it's not a resin. You boil the water and you collect it on
Oh, you're
your
talking
own.
about distillation?
Yeah, distilled water.
Okay, distilled water.
I'm sorry.
Yeah, oh, definitely. As a matter of fact, what I have in my home is a pre-charcoal filter that goes, water comes directly, from the line into my charcoal filter. It goes through that, then goes into my water distillation apparatus. It boils the water, condenses it, comes down. I'll recommend a couple of systems for you.
Right.
Durastil, the tabletop, I think it's called 30J. Pure water, and that runs about 600, well, Safe Water sells it for about $6.50. I think it costs a little bit more than that. I'll give you the addresses. As a matter of fact, I don't have my book now. That's in let's see, that one's in Kansas City, Missouri, Durastil. Then there's, out of Lincoln, Nebraska, there's Pure Water. The one I recommend there is their Aqua D Plus. Aqua D Plus, or the Aqua D. The Aqua D Plus is just nice because it has a rinsing unit that cleans out the boiling chamber. You don't have to clean it out as often. That's one of the biggest disadvantages to a distillery is every so often you got to clean the crud out that you otherwise would have drunk. And requires soaking in vinegar overnight or something like that. With the Aqua D Plus, it's the only unit that you can, depending on your water quality, either clean it out once or twice a year, or you may not clean it out at all.
So you have?
I have the Aqua D because the Plus wasn't out at the time. Now, the problems you're talking about, the charcoal filter, even if it gets contaminated with bacteria, it's going to still pull out the organic materials, the pesticides and herbicides, TCs and all that.
Why are you running a pre-charcoal filter if you're going to boil it anyway?
Let me get through the system first.
Yeah,
Okay.
fine.
So that comes through, then it goes in the boiling chamber, where the inorganics are taken out. The lead and mercury and all that type of stuff, fluoride. And then it goes into after the boiling chamber, if there's any bacteria in the column, that boiling chamber would not only kill it, but if there were any bacteria there that were still alive after boiling, they wouldn't come up in the steam. The steam is condensed down. Now, the reason you have a pre-charcoal filter is there are certain organic compounds that have what they call low vapor pressures, or boil around the same temperature that water does that will come across. The reason it would be more efficient to put the charcoal afterwards than before, but why do I put it before? Because of the bacteria that may grow in the charcoal. I want the distiller to do the last step. That is a system that I use in my home. Now, and I have my children have a smaller unit, the tabletop unit. The Aqua D Plus is about 1,100. The Aqua D is about 1,000 or 900 or 1,000, somewhere around there. The tabletop is 650. The tabletop makes about 8 gallons a day. The other two make about 10 or 11 gallons a day. Now, as far as a filter goes, I have just this last year found the first filter that I recommend. I've always said stay away from filters. because number one, they get cluttered up with bacteria. Number two, you never know when they're out. Well, this took care of both the problems. And number three, most of them will not remove fluoride. Now, this has a deionizing resin in it. It has a charcoal resin in it. It has an ultraviolet light that kills the bacteria. It has a meter that, because of my recommendation, is kept set at a 0.5 part per million total dissolved solids. That means if mercury, silver, fluoride, everything gets to 0.5 part per million or more, the light turns from green to yellow. If it gets even worse, if you let it go, it'll turn to red. At that time, you exchange your filter for another one. The filters are rechargeable. And the whole unit retails for about $416. We sell them for about $385, $395 retail. And the filter replacements run $30, and they're good, guaranteed good for 150 gallons. And if they're not, they'll replace them more often at the same price.
What's the name of that?
That's called PureTech. PureTech. And that you have to get just about through us because it's just out on the market. They're not marketing it that extensively at the present time. It's a local place out of Michigan, and you'll have my address on the pamphlet, Lifesavers Guide. But that is for people who don't want any problem at all. This hooks right onto the faucet. It's about so big, and it's the only.
Underneath?
Pardon?
Does it go underneath the
No,
sink?
it goes right on the top. If you have a coffee maker, it looks like a coffee maker. It's right on top. You just
How many
turn it on.
gallons will it make a day?
It'll make in a day. You can use all 150 gallons up in one day. So if you're having a big party where you're gonna fill up a couple of bathtubs, something like that. 150 gallons is about what, three bathtubs in a day. It'll do. Because it's just going through this thing. You're just using up the column. It costs 20 cents per gallon for the filter. Distillation will run about 15 cents, 15 to 17 cents a gallon. The water is just about equivalent, except I'm an old fogey. I like the old distillation systems.
Why is distillation so expensive once you've got the unit in there?
Electricity. Yeah.
Are you familiar with Professor Vincent's biological water studies, French?
Vaguely.
He has a whole different perspective about what's biological water. There are some units that are being produced in Germany and in the United States now that produce biological water to the parameters of Vincent. And none of them are distillers.
Well, I would imagine. I mean, for me, water is one of the few things that I want to be as inorganic as possible. Now,
Well, the three parameters used are pH, the redox factor,
Mhm.
and resistivity, or the lack of particulates.
it's coming back to me. I think I've read something. I wrote a critique on it, and I can't remember where it is right now. If I can find it, let me have your card, and I'll send it to you. There were a number. First of all, it was somebody quoting him. It wasn't him writing this. It was somebody quoting him, and they quoted him so miserably out of context. It's probably the number 2 worst thing that I've read. The worst being this thing called, this small little distiller that was supposed to, if you drink the water, it would make you stronger than if you're working out every day. Okay? I mean, it was just total fraud. I mean, some of the stuff out there is just bad. I mean, I work out. And I think the fact that I can squat with 600 pounds, I can bench press 300 pounds, I don't think I could do that just by drinking some type of special water or some type of specially distilled water. It takes a lot of work. I think good health takes a lot of work. It takes a lot of work on the part of your patients. If your patients aren't willing to work, I don't care how good a dentist you are, I think you're going to have a problem.
Well, you're familiar with the electroacupuncture technology.
No. That's what I
Okay,
came here to learn something about.
This whole system is based
I know a
primarily.
little bit about it, but the little bit I know is not going to compare with what you people know about it. Yes.
When you filter water or do the distillation process, you take out all the beneficial minerals as well. Do you then do a supplementation program in order to?
Okay. What do you mean? What is a beneficial mineral? Is phosphorus a beneficial mineral?
No,
It
calcium,
isn't?
magnesium,
Wait a second, wait a second.
Well, yes, but
Okay.
we get enough of that in
Phosphorus
our diet.
is.
Yes.
When
But
you
what
drink
about,
water, when you drink water, that has got minerals into it simply because it's been sitting in some rocks. Hopefully, it might be sitting in some manure for all I know. Okay, you just get the minerals that are there. It could be high in arsenic. It could be high in fluoride. There are naturally areas that are high in fluoride, where 100% of the children get dental fluorosis. Some so bad that the teeth break off. Arsenic, where even in some cases cyanide, in the rock structures. Teeth turn white, skin turns blue. You're not going to tell me any one mineral, whether is sodium a beneficial mineral?
If it's not in excess.
Right. In excess compared to what? Potassium. In respect to what else? What you need basically is a calcium to magnesium to sodium to potassium to phosphorus to sulfate, all the way on down ratio that makes physiological sense. Water never picks up minerals in any proportion, unless it's by accident, that makes physiological sense. Where do we get these minerals in a balance that makes physiological sense? Where? Where?
Vegetables, green vegetables.
Green vegetables. Foods. Live foods, because live foods take up the minerals they need in an order and proportion that is more closely associated with our needs than what water would ever pick up. So no, I wouldn't necessarily take a supplement unless it were, an algae supplement or seaweed supplement or something like
But
that.
that's also dependent upon the soil in which the thing is grown.
To an extent, but you're still much better off having it go through the filter of a living system than taking it right from the ground itself. I mean, there are certain minerals that you may still be deficient in, like selenium as being one, as an example where plants may not have the need for it that we do. But overall, as a rule of thumb, although it's not going to be, how should I say, sufficient, it is necessary to try to get your balance of minerals from live foods, live whole foods. Yeah.
Will deionized water then have any potential for removing minerals from the body?
I hope so. The question was, will deionized minerals have any potential for removing minerals from the body? We have to have minerals. If we're going to put minerals into our body, we better have them moved out. Otherwise, we're going to be a mineral man. There's a continual turnover that we have to have, and we will normally have that. I mean, salt will come out through our skin, minerals will come out through our urine. This just normally has to occur, and through our fecal material, we get minerals out as well. So I mean, this is something that we just have to have. Water. One of the purposes for water is to keep the body reasonably flushed out. It not only pulls out inorganics, though, because it pulls out organics, waste products, uric acid, urea, products of nitrogen metabolism that our body can't really handle anymore and can't recycle. I mean, our body's a beautiful recycling machine. It keeps on turning things over and over and over and over again, and it's finally left with things that says, I need something fresh. I gotta get rid of this stuff. I can't use it anymore. We use things that we eat many more times than man does when he builds buildings and makes plastic bags. I mean, if we were as ecologically, environmentally aware in our dealings with our fellow man and the things we use around us as our body is with the chemicals it uses, we wouldn't have any environmental problems at all in this country. But those things, and by the way, those things can be recycled again. I mean, you can take urea, put it back into the ground. You can take uric acid, put it back into the ground. If people would eventually, separate urine from the rest of their excrements and garbage and so forth, we could probably have a chemical industry that would thrive on just the products we get from urine. Urine, by the way, is, in a healthy person, bacteriologically pure. It's a phenomenal system we have. We start screwing up with all these things. Pardon? Yeah. Yes?
There's a process called reverse osmosis.
Yeah. Reverse osmosis. Here's the nice thing about the filter I was talking about versus reverse osmosis. Reverse osmosis will start out now in real large systems, where the systems are maintained continually by means of backflushes and so forth. Reverse osmosis is probably untouchable by any other method as far as being economically sound. I mean, big water systems you can desalinate with reverse osmosis. But if we're talking about a home unit, we had an eraser here, so
On the floor.
if you take the filter I was talking about, the PureTech filter, it's sort of like a titration curve. It'll remove, I like the red better. It'll remove about virtually 100% of everything until it reaches a particular point where it becomes saturated. It's almost like a titration curve. And it goes down like that. The nice thing about having deionization with something that indicates that something is turning, as soon as it gets to here, this light goes on from green to yellow. Now, by slowing down the flow of the water, if you got to order the thing ahead of time or something, by slowing down the water, you can bring it up here again, because you're allowing it to spend more time to fully saturate that thing. But you have maybe maybe a week or so, depending on what your water consumption is. You might want to keep another one on hand, and then it'll still come down. With RO, however, here's what you have with RO. Now let's say we're talking about fluoride. We want to get fluoride at 0.2 of a part per million or less, or half a part per million or less. Fluoride will be there all this time. Here you have about, well, you start off with maybe 90% removal, and here you'll have virtually 99.9% removal with the DI. And it'll continually be going down. Right around here, when you want to change your filter, you may be only removing about 40% of the fluoride. So you have got to decide how poisoned you want to be with RO, because it's a linear function rather than what you have with DI, which is almost a titratable function. And that's why I recommend this unit if people don't want to go through the old method of water distillation. I wasn't even planning on speaking about this. I mean, I have brochures on that and everything on the DI. But it's a beautiful unit. And quite frankly, is the exact type of unit that I had said would be the unit of the future maybe 10 years ago. But I am not an engineer that I can go ahead and make these things. The filter that they have is the major part of the unit. I mean, it's about that big, and it has baffles going back and forth like this, where the DI and the charcoal are packed together. And they have baffles here that make it go all the way around, so there's no channeling. It's a well-designed piece. And yes.
How do you recycle the filters? Is that a home job?
No, you send it back to them. They send you a new filter, and or it could be a recharged filter. What they do is treat it with acids and bases and so forth to get all the stuff out. I asked them, after you get all this junk, what are you going to do with it?
Yeah.
Well, I don't know exactly what they're going to do with it yet, but hopefully they'll have the stuff in concentrated form. They might be able to have a chromium mine there, with the chromium water they can separate. And really, you could. I mean, you can separate mercury. You can use it for dental fillings. Sorry about that. Okay, I didn't mean that. I really didn't.
Your Consumer Reports, the patient brought in a piece of paper, and I think it came from Consumer Report or a magazine like that, and it was what to do when a thermometer breaks. Be very careful. Don't breathe it. Women and children should not touch it, as it's poisonous. And then it says, however, you might want to take and pull it together, collect it, put it in a little jar, and give it to your dentist. He can use it for fillings. Honestly, that's what I said.
Where's it at? Give us one.
I love it.
Give us a copy.
Well, I got it.
Bring it tomorrow and give us a copy.
I got so much stuff I gotta bring you.
Yeah.
Is this Lifesavers Guide the best thing to give to our patients and
Absolutely.
pediatricians in the community and
Yeah.
so forth?
Mm-hmm. And by the way, that little pamphlet there provoked from the Public Health Service a 219-page book that tries to take it apart. And I have a rebuttal thing for that. I mean, it's just totally ridiculous. But
Do you
it's,
have a copy of that rebuttal?
yeah, I have one copy.
Is it 200 pages or?
Why don't you give it to me, we'll get it made up tonight.
The rebuttal is about, let's see, I think it's about 10 pages long. I mean, it's easy reading. Some of it's boring reading, but it's easy reading.
John, why don't you get this all made up tonight? We'll have it all
Okay.
made, a copy made for everybody. They got a Kinko here, it stays up 24 hours a day.
Great.
You take it in there, you get it all back in the morning, like rabbits, I think we're gonna break for lunch. Any last burning questions you wanna ask, John, before lunch?
Let me say that when we come back from lunch, we'll be getting into the solution. In other words, hopefully I've got you concerned enough and hopeful enough that we can do something, that we're going to talk about how we're going to do it.
Well, you can see what it took in fluoride, which is only one issue. But once you get them going backwards on that, it isn't gonna take much to get them going back. And the mercury issue is gonna really hit them harder. I mean, they're going backwards on that too. So, let's get back here. At 2 o'clock, we're starting, whether you're here or not. All right.
What time do you want?
Okay, yeah, sure.
Don't drink that water, drink the bottled water.
That's what I thought.
John Yiamouyiannis forgot to tell you that there are 2 good waters available. They both happen to come from France. One is Evian, and the other is Volvic. And I recommend the Volvic. That's the other thing, is to buy good water.
Record this?
Yeah, you might as well. To buy good water. Now, there's some detractors from that idea, but you can taste the difference. You can actually get well by drinking Volvic. A simple expedient like that.
What's your experience?
By drinking.
Volvic water.
How do you taste the radiation fallout?
How do I taste the radiation fallout? I think you have to measure that with a Geiger counter, right? But it's worldwide, you know. There are things you can take to reduce the damage, like clays and different things in your body. Certain plant materials will do that.
Salt and soda baths.
Yeah. Okay, we're going to continue with this afternoon with Dr. Yiamouyiannis on the what you can do part, I guess, on the nitty-gritty. Right, John?
Yeah.
Okay, let's get started. Oh, just one short thing. We're going to probably quit about 5:15, 5:30, and so we can have a dinner, and then maybe come back here, I hope at 7:30 for our night session. Bill Moore should be here. Gary and I, we have a tape we want to show you, and that will be open discussion. So I don't know, it's a free form kind of thing tonight. So you can tell us your problems, and maybe we might collectively barnstorm some solutions for everybody. Okay, John, please.
Okay, since we had a little time to think over lunch or whatever we're doing during the lunch period, I wanted to ask, before we go any further, were there any questions that we didn't clear up, or anything you thought about at the lunch that you'd like to deal with? Yes.
From your perspective, what would be a safe limit for a dental restorative material that would give off so many parts per million? Can you give us a range in there so we can find out from the manufacturers what the ionization saturation is, and so we can make some judgments on the safety of it?
Okay, well, here's probably what I would ask you to do. Get the data and pass them on to me. It'd be easier for me to work that way. It's like saying if a patient comes into my office with a problem, give us guidelines on how to treat the patient. It's more easy if you describe a particular set of patients for me to be able to deal with those individual cases. You're not concerned so much about the concentration, because it doesn't really mean too much. Concentration of what? Ionomer? Yeah, that will help. I'd like to know what the concentration of the ionomer is. But aside from that, the only thing I would want to know, if you want to know things, amount given off, I'd rather have it in terms of micrograms per unit time that is given off, or of the total amount of fluoride that is in that ionomer, how much will be left after a year, or 2 years, 5 years, 10 years, etc. To be able to give you some idea. From what I understand now, if we're talking about 14, 15 parts per million, they're just giving you some garbage that, I mean, that means nothing. I mean, if you're using ionomers that contain 14 parts per million in the ionomer of fluoride, it's almost laughable. I would imagine it would be so tightly bound to that it would be the lowest fluoride hard tissue in the entire human being. So I think it's really a dog and pony show type promotion. Any other questions? Okay, if there aren't, I'm gonna hit a couple of things that will hit you because they're there are things that have to be talked about. There are things that get things done. And we're going to be talking about time, money, commitment, what you people want to do, what direction you want to go in. We all put a lot of money together, but we're going in different directions. We're not going to get anything done. In order to get a job done, it takes not only power, but power and direction. As an example, if we were to get everyone, if we were going to have a project, and everyone here was going to put $5,000 into that project, this is what you don't do. And I'm going to change these caps. I'm confused here. No, the red is on the red, the green is on the green. All right. I like red. It shows up better. If we all have a lot of power, but we're going in different directions. If you've had physics at all, what's going to happen to that center point?
Goes in circles.
Any other guesses?
Dissipates.
It's not going to go anywhere, is it? You have a tug of war, a three-dimensional or four-dimensional tug of war. Everyone's going off in a different direction. Now, if we use even a smaller amount, let's say we have $2,000. Everyone's going to contribute $2,000 for a particular thing, whether it's the fluoride thing, whether it's the legal fund, or whatever it is. And you have a point here. These are what they call vectors, by the way. You have motions like this. 1, 2, 3, 4, 5, 6, 7, 8, I guess. 3, 4, 5. 1, 2, 3, 4, 6, 7, 8. Okay? You'll basically be getting a vector that goes like this. What's going to happen to this point, the vector will look like that. There is none. You're not going to move. You're not going to go anywhere. So it requires two things. If you put, say, a $5,000 commitment and you line them up, you have a strong directional vector. Now, you're never going to have something that's going to perfectly line up. It'll always look something more like and the vector will end up looking in the end like something like that. So there's going to be some wastage, no matter what you do. The idea is you want to use funding as efficiently as possible. And what you do is, number one, you try to find someone, something that you're working on that has good direction, and that's efficiency. And then you want to make sure that there's enough power to get that thing going, that you don't end up with something like this with that much power, because you're going in the right direction. Which is it's like putting in a putting green. At Pebble Beach, and we're right here, you know. You can putt across and be off in direction, then putt this way and putt that way, and try to get into that hole with plenty of power, but you're not going to get there. Or you can be real accurate and keep on putting it 2 inches on a 10-foot putt, and you're going to have a multiple bogey on it. So you got to put both together. You have to have that commitment. You have to have that willingness to say, I'm going to try to get a hole-in-one, or I'll be doing one stroke and somebody else can do another stroke, but when I get that ball in, when I get the job accomplished. With regard to the fluoride issue, I'll be talking to you about it later, and I'm going to be getting off of it, but I'll ask you to think about it. Think about, seriously, how many of you would be willing to contribute as much as $1,000 to see fluoridation stopped by July 4th, 1990? For us right now, we need the push at this point in time. I'd love to have every one of you write me a check for $1,000 or more to get this thing out. What does it do for you? It helps us. If you'd like to break it up into 5 payments of $200, that's fine. But right now, we need it so badly. Because, is Gary here? Yeah. Gary, tell them what you told me about Sacramento already.
Well, John and I spent a lot of time at the National Health Federation a couple of weeks ago about this subject. And as he said, it's such a big opportunity, but if we don't stay right behind it, in Sacramento, when it hit the television, they had all the forces right there to say, so what, no change, nobody should change anything. So they were right back to status quo. Whereas in fact, to prove that the stuff was doing nothing and it has a distinct danger, the benefit-risk ratio is completely followed up, and we'd like to have gotten this as the eye-opener to start to move the pesticides and the other chemicals out. So they've already killed it without some force behind it. They've got the public lulled back. Instead of like the Aller thing, when you put a lot of effort behind it, everybody got worried about apples and it changed, and they took Aller off the market. But it takes a lot of force.
And the problem, too, is something called the barn door effect. To have the funds come when the barn door is shut, the horse is out, the barn door is shut, everything's fine, but the horse isn't there anymore. This is the situation where there's two things that are affecting us now. Front-end loading. I had a fundraiser over to see me. He said, oh, you know, we'll develop a mailing list for you and so forth, and 2 years down the road, I said, sorry, I can't go with that because we've got to have it now. Think about it. I'm not going to ask for commitment at this time. Maybe at the end of the talk I will. The second, yeah, sorry, go ahead.
What is it used for, paying off lobbyists or what?
No. The funds are going to be used entirely for staffing an office that I'm working in. It'll pay for, in part for my salary. It'll be paying in part for the professional staff or secretarial staff we need. Right now, I'll tell you, we're running ragged. I'm working with a couple of volunteers. Sometimes, I mean, even for things as mundane as stuffing, for the cost of the office itself, to maintain the office. I mean, this is not, we're not selling a product. We're not providing professional services. We don't have insurance paying us in. We exist totally on funds that are raised in order to stop this. Now, I'll be making another analogy, but what we're going to be using is, for example, if I were to pay a PR person, which I could do, $1,500 to get on Oprah Winfrey. How many people think it's worth $1,500 to get on Oprah Winfrey? Okay, is that money well spent?
Yeah.
Yeah.
Okay, another $1,500 for Sally Jesse Raphael. No. Well, I'll tell you, as far as PR goes, you know, if you compare one appearance on Sally Jesse Raphael to any mailer you can do for $1,500, I can assure you we're going to get more support. The stuff that occurred in Newsweek, that didn't occur there by chance. It was carefully planned telephone calls. Our telephone bill is somewhere around $1,200 a month now. Why? Because it's telephone calls that make these things possible. Back and forth between ourselves and the EPA, between ourselves and the Newsweek. Sharon Begley and I don't know how many people heard, anybody of you hear Newsweek on the air or heard the program? It's broadcast on 110 stations. They preview Newsweek. Sharon Begley, the author of that, myself, it's put out by Newsweek, by the way, did we did a 10-minute segment and a half-hour program, got to 110 stations telling people what was coming, what Sharon was going to write, and what I said basically in my press release. These are the types of ways that the funds will be used. Now, if I were to go to a professional PR person, they would charge me something in the order, just for that aspect, about $10,000 to $15,000 a month to get it out. Ideally, I'd love to put it in the hands of a professional PR person. We'd get more coverage. And quite frankly, I think it would be cost effective. The funding, the budget that I have right now won't allow that, but will get us on some of the major talk shows, and hopefully that will spread. Then we want to hit major market areas. Another PR person told me $5,000 for each major market area. We think we can do a little bit better. But these are the types of ways in which we spend the money to get out there. We've got about 5 months to get this thing done. And right now, of course, is the period of time where we're going to have the least power when we need it most. It's like a snowball. If we get through the first or second month, the third, fourth, and fifth will follow, and we'll have enough, how would I say, momentum. And this is why when I was speaking in front of the National Health Federation's Board of Governors, I was telling Gary, if NHF would get behind this and support it all the way, which I wanted them to do, by the time the fifth month came, we'd be running on, momentum. And I don't know where NHF is right now, but this, without NHF being with us, and without the support, that we need, right now we're running them empty, and we need funding, and that's where the funds would be used. It would be used to pay myself, to pay our staff, to pay for the PR, to pay for the travel, to get there, back again. They have a meeting coming up of American not Waterworks Association, but the people who put stuff in the water and so forth. It's going to be down in Tampa. They're going to be having a convention, I think, on February 12th to 15th. Right now, I don't even know if I can afford to go down there, but it is so important for me to be there because whether they're going to be talking about, they're going to be talking about my work and what the EPA is saying. I'd like to get myself down there. I'd like to get Bob Carton, who's president of the union of EPA down there, and I'd probably have to pay his way from our side. And the damage we'd be able to do there in about a week or two from now would be unbelievable. It's horrible if the fact is that we can't even afford to get down there because of the cost of the transport or the cost of a motel or hotel. My time has gotten so, how should I say, so taken up that I almost need a person with me to tell me what I'm doing every moment of the day. I mean, it is true. I mean, and if somebody would like to volunteer for the next 5 months to be my guy or gal Friday, you know, that would be worth thousands of dollars right now. So if anybody wants to volunteer, you know, doing that, and is a good planner and a good telephone person, you know, let me know. Now, commitment also comes with regard to the problem that you have right now. And that is, you want to have legal representation. You don't want to be harassed. You want to see things get better. And this afternoon we're going to be talking about various solutions, the deluxe plan. We talked about the crisis plan, and the crisis plan is an easy plan. Crisis plans always are easy plans. When the crisis occurs, you just put whatever money you have into it, and or you put a little bit away in your savings account, not enough to take care of you during your retirement. When your retirement comes, you just use what's there. And when it runs out, that's the way things go. The crisis plan. Let me work from the bottom up. A crisis plan. Everybody here puts $100 a month into a fund. You might put it in CDs or something like that, have it earn interest for you and so forth. And when you build up a certain amount of money, you know, start taking dividends and passing it around to your members. If it's not exhausted before that time by some man with suit or person that dries your whole fund out. What happens at that point is you have a lawsuit, a big lawsuit. You have maybe $3,000 in your crisis fund. You have legal fees for $50,000. And yeah, the person says, forget it, you have to keep the $3,000. It's really not going to help me at all. That's the crisis plan. The tourist class plan. The tourist class plan is a little better. You put enough funding together where you can hire a person who will serve as basically a science consultant, a liaison between you and the lawyer. You hire a lawyer, and you develop enough funding to pay the two of them to chest handle cases for you on a part-time basis. In other words, that's all they do. They have other things in their life, and you happen to have a case at the time, and the lawyer is busy on another case. Well, he'll try to continue the case or postpone the case until he's off that case and onto your case. Which is a heck of a lot better than the crisis plan, because at least, aside from maybe transportation costs and lodging costs and court costs, which are not that much, your legal fees will be paid, because basically you're retaining that person on sort of an insurance type basis. And the deluxe plan. The deluxe plan is a plan that makes me smile. Let's say the first plan cost $100. I love the deluxe plan. Who likes to fly first class? Anybody here? You don't? Okay. They put the smokers up there.
We want to do some smoking. Do some smoking.
Gary
I mean,
flies first.
if they cost the same, who would like to fly first class?
Hey, Cecilia, come on.
No, she doesn't. All right, fine.
Come up with the big seats, you know.
Hey.
Okay, so we have the crisis plan, the deluxe plan, the tourist plan. The deluxe plan is this: you hire on a lawyer full time. That is your lawyer, and you say, well, we're not going to have court cases now. We're going to be hiring a lawyer full time. What are we going to do with a lawyer? You know, it's just going to be sitting around. Well, first of all, you got to break the lawyer in. You got to get the information to him. You want to have a liaison person. This is the part that I would fulfill for you if you'd like me to. Serve as liaison. I know hardly anything about the electroacupuncture right now, or the other things. I know about mercury. But some of the other things you do, I don't know about. But I think I have enough intelligence to understand it. Because what do? My major purpose is to dig things out of the most technical areas, understand them very carefully, and then put them in terms that a layperson can understand. So I do the same thing with what you have. And even in that process, just that process might get you to rethink. It's when you're teaching a course. How many people have taught courses? Okay. When you think, when you're learning it, it's one thing. When you're practicing it, and then when you got to teach it to somebody, how many people get the feeling, hey, you know, I never thought of that before. And you start, by teaching, you start learning yourself. Do you get that experience? And by teaching me, you might get the same experience as well. But you teach me, I pass it on to the lawyer in language he can understand. You relate to the lawyer, and then I'm able to use all my background in biochemistry, and physics, chemistry, and so forth, to say, okay, how are we going to defend this in court now? Here's a person who comes up with a machine, you know, puts a bottle in a person's hand, and so forth happens. How are we going to defend it? And I'll be able to tell you that in some of the things, we might even be able to defend it. I mean, it might be just totally indefensible. I mean, it's so far out that no court will ever believe it. But I'll be honest with you. You know, I'm not going to kid you around to say that we're going to be able to defend something that is indefensible. And if there is a way of defending it, whether it's through science or anything else, I'm usually pretty good in doing that. I remember one court case, we had a very corrupt judge, and we lost on the basic facts, the strongest facts we had. But we won on the fact that I found one technicality. I mean, the judge said, well, it's obvious that fluoride reduces tooth decay. It's obvious that fluoride doesn't cause cancer. Well, he didn't have the benefit of reading Newsweek magazine. And I'm going to declare it absolutely safe and effective. But there was a law at the time. This was in Scotland. I was a consultant to the Scottish Legal Society. And I went to the University of Edinburgh. There was something in the law saying, nothing shall be added to the water supply that makes it less wholesome. And this was towards the end of the case. This is the longest court case in Scottish history. It's a pretty long court case. By the way, my testimony in the case was the longest or second longest scientific testimony in world history. It's 23 days, 5.5 hours a day. And so, you know, if you think I'm going to exhaust you now, just wait around for another 20 days and see how exhausted you can get. And after all that, you know, we lost. I mean, we'd won the case hands down, but the judge was going to decide against us. My attorney, you know, pretty well indicated. So we went over this wholesome thing. I said, well, what is wholesome? I spent probably a day's researching the word wholesome. I can tell you things about wholesome you wouldn't even believe. It has to do with holy. I mean, you know, holy, this type of holy, and we finally got fluoride out of Scotland, revolving around the fact of how the word wholesome is defined. So, you know, if we can't get it scientifically, we'll get it some other way. Now, there's another thing. There are ethical considerations on all of this. I usually end up being a plaintiff's witness. I'm an aggressive witness. I'm great in defense. I'm great at stonewalling. And I could probably get some people off the hook who don't deserve to be off the hook. And here's one thing I would say. I was talking to Ed, and we were talking on the telephone, and had a good discussion about this. We have got to come, I think it's good that I'm coming from a consumer standpoint. Because I'll tell you where I think a consumer might have a good case. I'll build up a much better case than the other side can ever build for themselves. And I'll be able to stonewall that. But there are issues like this. If Ed's wife were to come home one day, she made a big smile and there were no teeth in her mouth at all. And she said, darling, I feel great today. I won't have any more low-grade infections. Now, most of you think of that. Think of that real carefully. You might say that SOB, you know, I'm going to sue him for everything he's worth. And in developing a legal fund for you, I will insist that we try to set some type of a standard, industry standard, that if you're going to end up pulling people's teeth out to relieve some low-grade infection, that not only should you advise, but you should get the signature of another dentist and a physician. So, and also probably talk to the person's spouse, you know, and get them both to understand what's going on. Have signatures all over the place before you start doing something that that drastic, no matter how indicated it might seem, unless it's an emergency situation. If you don't pull that teeth out of the person's going to die on the spot. These are the types of things I think, will be helpful in setting up, will prevent court cases from coming that would not normally come. Anything that's super out of the way, anything that's going to cause any great amount of trauma, you should get together, have some type of a committee, and decide what are the most sensitive areas, the areas in which you think you're going to have the most problem. And then solve the problem beforehand. And put yourself on the other side. Put yourself in the other person's shoes and decide how you would feel if somebody came home with a $10,000 bill and said, I have glass ionomers in my mouth. Aren't you happy? And the husband just about, or the wife breaks through, there goes my new kitchen or something of the sort. I mean, people have the priorities. These are things that you've got to consider. They'll make the job easier. The deluxe plan is going to run. These are monthly fees, approximately what you might put in. And this is going to be a range, and we'll talk about the range. And this is a startup. After you develop a history, the price may go down. But you've got to develop a history. We're talking about $350 to $500 a month. Having a full-time attorney working for you. Having a liaison person working with you. And what does that attorney do, and what does a liaison do when you're not having court cases? They should be working full-time. I don't like to sit around doing nothing. And the EPA, what they do to bad people who blow the whistle is they put them in an office, seriously, put them in an office with nothing there, with no work to do at all. And drives them nuts. And that's the way to drive people nuts. One of the healthy ways, to take care of a body is to use it. One of the healthy ways to take care of an attorney is to use him or her, as well as your liaison person. And here are the types of things they should be doing. I have a new deluxe plan setting ground rules, second opinions, getting physician's approval. We were talking about INDs this morning. I may go over that again. But what they should be, yes.
Are you just summarizing, or can I ask questions about it?
Sure.
What do you mean by getting second opinions?
Second opinion is when I talked about, you say, Mrs. Calabash, you need very much for every tooth in your head to be pulled out. That would be, I think, legally, in case there might be some suits coming out of this, that you want to go and have Mrs. Calabash go to another dentist for a second opinion. Now, the person doesn't have to agree at all, but at least when something that, how should I say, dramatic is going to be done, a second opinion along that line, and maybe even having a medical doctor give an opinion on it. Yeah.
What I'm thinking is, to make that fair, you would want them to go to another dentist of their choice,
Absolutely.
A physician of their choice.
Absolutely.
And
not send to Dr. Arena.
yeah, not someone else
We'll
in the
say,
group.
sure.
Yeah, not someone else in the group.
Exactly.
And I'm having a problem with that, with even that. I'm just hearing, people talking about taking their teeth out. I'm pretty much new at this myself.
Yeah.
But my hesitation is that it would be quite futile to allow that person to go to a dentist of his or her choice, or a physician, and get an affirmative second opinion.
It doesn't have to be affirmative.
You don't care whether they agree?
It doesn't make a difference whether they agree or not. The idea is...
Well, what's the idea, yeah?
The idea is they have gotten an opinion from somebody else.
Who
That
totally
person tells
disagrees
them.
with it?
That person tells them,
Okay.
that
So it reinforces the consent, really?
it reinforces the consent.
Informed consent.
No, I'm not talking about going around until you get another doctor who agrees that mercury amalgam fillings are bad. I feel more comfortable being Diogenes walking around with a lantern in Carmel than I would trying to find that many dentists in Carmel that think mercury amalgam fillings. Are there lots of dentists around here that believe that they're bad?
There's a few.
There are a few. Because of you?
No,
No?
just because of
The news?
the aesthetics,
I see.
And physicians are like on the fence but don't want to make any waves. So you can talk to me about it, but I won't back you up and come out and say that.
But if somebody were sent to them, they might say yes, they might say no.
I think they'd honestly say yeah.
So in some cases you might, in the less extreme cases, you might get support. In the more extreme cases, you might get less support. But the whole idea is this, that you can't be accused of some type of charlatan who's quickly trying to take all their teeth out.
Okay. Well, the point he makes also is about alienating your colleagues, because they haven't taken the time to understand the problem as you realize it, okay? So you send the patient over there for the second opinion.
You don't. No, they go on their own. They choose a person.
Well, they choose somebody, they get
Right.
another opinion, and they come back and they say, well, he said everything was just perfect in there, and I don't need any teeth taken out, or I don't need this, or I don't need that. And they're setting up to have a big argument with this guy,
Mhm.
you know, whether it's a physician or a dentist or whatever.
Mm-hmm.
And so where do you take it from there?
Well,
You
you
guys
know,
accept your plan?
Well, I understand they don't accept the plan, but maybe they're on the fence. Well, what do you do? I mean, do you want to just continually alienating or inciting animosity for your own particular cause by insisting that you get a second opinion?
well, I don't think, you know, if a patient were to come to you, not your patient, if somebody else's patient come to you and said, you know, Dr. Rana, I want to get a second opinion before I go through with this, you know, surgery.
Oh, absolutely, yeah.
Would that antagonize you or
Not at all.
It shouldn't antagonize anyone.
No, I tell them to go do
Okay,
it.
but we're talking about something that is really contrary to the standard of care here.
Uh-huh.
And we're talking about not doing root canal, let's take an example of not doing root canals, but taking out a tooth instead, which
Right.
I hear may be a possibility here. That is so far from the standard of care that if someone had come to me even 2 months ago and said, Dr. Arana wants to take this tooth out because he doesn't believe in root canals, you know, it would really have raised some questions about Dr. Arana in my mind, and it would create, I think, some animosity in the dental community about people who go around saying you should have the tooth taken out instead of root canal therapy, which is considered an accepted treatment modality. So if an endodontist gets a hold of this, and they might go to an endodontist for a second opinion, then all kinds of things happen. We've got a thing in our community where general dentists are doing some orthodontics, which is perfectly legal to do, but the standard orthodontists, the specialists, are offended. So now we have a little sub-thing where there's an orthodontist who gets together with a periodontist who's a specialist, and an oral surgeon who's a specialist, and a prosthodontist who's a specialist, and they're creating a big lawsuit against the general dentist to exemplify how bad a boy he is for doing what they should be doing.
Okay, but the point is, if they're filing a suit, you got to have grounds for filing the suit. What are they filing the suit
Well,
for?
they
Competition?
They found someone who was being treated.
Okay,
Who was being treated.
that's who files the suit. You see, the person is being treated. The point is, if that person had gone to them beforehand
Right.
and said, you know, my general dentist wanted to have your opinion, a particular procedure he's going to use for a root canal or something like this, and the person then at that time told the person, I'm against it, signed this thing, the person signed that they knew, comes back to you and says, I like your price better, you know, and I like the concept of holistic dentistry rather than just having every piece of my mouth or my tooth in somebody else's hands. I'd rather go to you. I think you're in better shape to defend a suit that way than if you just go ahead and do it and have these guys line up against you.
I have no doubt that you're right. I'm just saying, as far as the practicality of this, take fluoride, since that's close to your heart.
Yeah, but-
Someone's coming, and I no longer write prescriptions for fluoride supplements. So they go to their pediatrician, they say, Dr. Paulos, he does not want me to take fluoride. And the pediatrician gets upset. Why would he, the standard of care is fluoride, and he pulls out the magazine from the California Dental Association saying how much fluoride there should be in this community because the water is deficient by this much, and writes a prescription. They come back to me, they're all upset with me, and they go to another dentist, okay? So I'm a little bit reluctant to send people to ask for that kind of treatment by saying, well, okay, but on the other hand, if you had taken fluoride or whatever, and, you know, that's, you know, I can't make a good analogy with that, pulling it through, because you can't
Not with the fluoride.
prove the thing.
It's kind of like having a peer review,
Yeah.
except your peers don't know what the hell you're doing,
Exactly.
you know?
Yeah.
If they
And
did, they
if
would
you've
be.
been there before and you try to explain to them, you know, you're not my peers, they look at you like, oh, really?
So you end up, the pediatrician no longer refers you his patients, because he thinks you're kind of weird, and it
Yeah,
just
well,
snowballs.
Yeah, the fluoride thing is entirely different. I mean, in the end, it's like anything else. In the end, you've got to decide, and I think these are things that can be made very clear in presenting it to the public. You've got to decide who your major responsibility is to. Is it to your patient or is it to your peers? If you feel, if a pediatrician is prescribing fluoride, and you are absolutely convinced that this is going to cause irreparable harm, serious and irreparable harm to your patient, are you going to come out and say, I don't care whether your pediatrician suggests fluoride, I want you to stop taking them, I'm convinced enough? If you were convinced enough, would you tell that to them or not? And what's going to happen to your pediatrician? He'll still stop referring people to you.
I understand that. I'm just asking, is it
Refer, by the way,
necessary-
is a two-way street.
Yeah, that's true.
The type of patient that comes into my office usually has already had a second opinion, and they want to have the fillings out anyway.
Fine, then just get a person's signature.
Well, that's what I mean. I don't quite understand what he's saying.
Well, but it gets down to
Well, I'm going
the,
the other way, where I'm assuming they haven't had
well,
that.
it gets to the point, if you have somebody that's been around and been a dentist and they're a little antagonistic and show me and that kind of thing, and you can demonstrate to them that their mouth is causing a problem in their general health, fine and well. And if you're still not sure, then you write out a specific consent form and exactly what you're going to do, everything. And every possibility you can imagine on there, and then you have them make an appointment with your attorney, and you have the attorney read it to them, and have them sign it under a wit. I'm telling you, that you've got to do that if you're going to do it, or just say, I don't need you, goodbye. You know, that's one or the other. It boils down to that. So there can't be absolutely clear, no mistakes.
And the other thing you want to do is, if this person has some low-grade infection, they probably have been to a physician about it. I mean, they'll come to dentists for low-grade infection. Usually, I imagine they go to the physician. It would be nice just to have a physician's admission that, you know, I've tried this antibiotic, that, and so forth, so nothing seems to work.
And another thing that we're not doing, and we've talked about it, we're going to try to devise a protocol, not only for all the testing and everything, but what a biological dentist should do, what his education should be, and how we can unify the whole concept of diagnosis so that when you apply the therapy, you're reasonably assured of coming close to the same kind of results, whether you do it in New York, Wisconsin, New Mexico, or California, you know. So, or Washington, yeah. They have exceptions up there. And we've talked about it, but the main emphasis of the group was, oh, we should know more about how to legally protect ourselves. That's why John is here and Bill Morris come in, and they've already started another organization. And there are attorneys that are out there that you hire on and you pay them so much a month, and they take care of the whole group, okay? And they're hired gun for that group, and they do that. But we're here to, and there's other people that have other ideas, attorneys. And there was one that was going to come here, but he wanted too much money just to talk to us about it, you know. And I told him we weren't a big group. But we need to know how to protect ourselves. And the real problem is when you realize what we're doing currently as treatment is wrong, and it's not only wrong to the patient's health, it's the whole profession has made a mistake. Well, how do you tell them? I mean, I have chiropractors that understand the problem of bioenergetics, and you tell them, well, how am I going to explain to my colleagues that those things that the dentist looks at as fillings, those corroded gray things in their mouth, are a toxic scar to that individual and damaging them every minute while they're there, every second while they're there? How are you going to tell them? Is that tough?
But you know what I do, is I tell my patients, you know, about toxicity and so on. And then I tell them right up front. I tell them, you know, the ABA does not agree with this. Neither do 99% of the dentists here or the MDs. And most of the time they say, Yeah, I've been around the block, I know that. And they'll tell you, I've already been through it with the AMA and AD, I mean, other dentists. Most of them, a lot of my referrals come from homeopathic physicians or naturopaths and so on, and that really helps. I have to sit there and explain it to them.
There's another thing that the dentist should be doing, when he takes a tooth out or takes an amalgam out. You supposedly evidently should save it. Now, I don't save all the teeth, but you should also get the detritus, let's say, in the socket, and curette it out and clean it out, and put it in a specimen jar and have the pathology lab give you a histopathological report on that tissue. And
But
we've
John,
done it.
Ed, that's hard to do if there's no tissue there.
I understand that.
And they don't do bone.
Well, they do bone.
Sure. Tooth?
Yeah, they'll take, if you have a tooth, let's say you measure a tooth and you find the tooth is non-viable, okay? So you say, well, I want to get a histopathology report of the pulpal contents, whether it's chronic pulpitis or necrosis or whatever it is, or maybe there's no pulp in it at all. So you send it to the lab and you write out the crow's description, and the pathologist will dissolve the tooth away and get that material, make a slide out, look at it, and give you a report back, telling you, confirming your clinical diagnosis, and that's what you want.
After you pull the tooth out?
Yeah, we've been doing this. We've probably got maybe 35 different reports back.
Do you do it for every tooth or what?
Well, not every tooth.
Okay.
But I do it in selectively, you know. And Alex, out of the 35 that we've sent in so far, only one has come back where he didn't rule out what I said, but I didn't get in the wrong specimen. And a lot of times when you're cleaning the bone out, there's not much there. This cancellous bone is very thin, and the vacuum sucks it away, and then it's gone, and then all you got is good, strong cortical bone or something like that. So you might send them a piece that's actually good bone versus the stuff that's in the bone cavity causing the problem.
Well, you know what I think I would do? I mean, it must cost a little bit of money for them to do this analysis now.
Well, I think it's $45 to $75 depending on what he does.
Yeah. I was just saying, what you might consider doing is this. It's not a very hard procedure to put these things in ethanol, formally fix it, and just have it sit in a jar. And if anything does come up, you'll have the tooth there that can be examined by the pathologist at any time.
Right.
I mean, all you have to do is have it sit formally.
So one thing I've done is taken the apical 1/3 of a root canal and put it in a medium, send it into the bacteriology lab and have it cultured out. And they'll send you a report of the bacteria that was there. And I haven't seen one come back yet that didn't show bacteria that shouldn't be there. And I've done about 40 of them. So if there's any question in my mind that might be a kickback to the patient, I charge them the price of the pathology report or the bacteriology culturing. And I've never had one of them grab that.
What does it come back as, the bacteria that's there?
When
you're extracting teeth, you're going to have some contamination just in the oral cavity.
No, what they do is they culture the inside of the root canal. They split the...
They split it,
yeah. Yeah, I'm sure you're going to get stuff in the outside.
What do you charge?
I just charge them what the lab charges.
What do you charge for that?
They charge about $32.
The lab can bill the patient directly.
Yeah, they do. I have them billed directly, or if they want it, they can pay.
So you have to culture the contents of the root canal.
Right. You should go right to the lab and
Middle
talk to the
third.
head of the lab and tell them what you want to do and why you want to do it.
Is it apical 1/3?
Yeah, I just tell them I want to cover my backside. He knows what I'm talking about, so he takes care of it.
I certainly don't think the concern about sending a patient out for a second opinion in the Orthodox community is a moot one.
I don't either.
If,
No, I'm, you know,
if you
this
send
is
someone
why
out,
I'm here.
you send someone out for a second opinion, and the dentist says, I don't know what those lunatics are telling you, take out all your teeth. And then the first thing he's going to do is go in and get on the telephone and call the state board.
No.
For doing what, though?
No, you haven't done a thing?
You haven't done anything.
You haven't done anything.
You haven't
just
done
gonna-
anything.
No, you
You
don't
ask
have
them
to
to
do
do
anything, they'll
nothing.
just call and say, you know what this crazy man is doing.
No, you didn't do
Tell
anything.
me.
You're not doing anything. You haven't done a thing.
They can
But
send
they-
reports
but they'll
and
come
start.
investigate you on the basis
Yeah.
of that you are telling people this.
That's right.
So the whole
People-
thing with
you have an
Orthodox
opinion.
dentistry is to save the tooth at all costs, don't
That's
pull
right,
the
they
tooth.
can nail you
And
for
And
someone
what's
is
the
saying
price? See,
take the
that
tooth
this
out.
hasn't
nail you
gone
for
down,
telling,
and,
not telling the truth, that's what they say.
it's like when I went to Germany and I wanted to find out what the biological dentistry, what's that all about? I knew a lot about dentistry. And Dr. Cromer was sat there and he says, well, I can't tell you in an afternoon. And I said, well, okay, well, when can you tell us? Well, maybe someday I can come to America. You know? So I said, okay, so for the last 4 years, there have been several people come and explain to us what the whole idea was about. And it's really not a revolutionary new idea. It's an old idea. It's where American dentistry was in 1940, before the advent of antibiotics. There's been a general decline in the technical skill of the dentist. There's been a general decline in the quality of x-rays. There's been a general decline in, there's been an increase, of course, in the use of antibiotics, which muddle the osteological, pathological changes that normally occur in bone. So the dentist looks at it, he can see there's some disturbance there, but he can't really say it's this or that. Ask the patient about it, the patient says, no problem, never bothered me. Hey, I can find something I can get $600 for, let's do that. I mean, I don't need to look at that too. And there's more, and this is going on out in the community, unbelievable, because there's studies that have been done in Germany and in my own practice. There's at least one hidden infection area in every patient, at least one. And the people that have had 4 wisdom teeth taken out at the same time, covered with antibiotics and pain medication, you can be sure that, that unless the person was 12 years old and an athlete, you can be sure that that overstressed that system. When you close it, covers it over, but you've got a bone cavity, you've got a problem there. Small intestine, heart, okay? There you are, in your ears.
I would say this, and this goes, I said before that someone was asking me about talking here, and I try to convince my audiences that I probably learn more than they learn from me, which is great. I mean, that's the way I think it should be. And your concern about about the referral idea is something that, you know, I think about. I don't have as much experience about as you might have if you have referred people. In other words, if you've done it. But I think a lot of it might be fears that you have of something that hasn't been done. I mean, how many people have done a referral to another dentist just before they extract a tooth? Anyone here?
Oh, yeah.
A couple of people have. What have been your experience?
Well, I generally would refer to an oral surgeon if that's gonna happen. And I'll give them a tentative diagnosis of, let's say an infection in the bone.
Yeah.
And tell him what bacteria it is.
Yeah.
And he'll look at me and say, say what?
blood.
Because, in Orthodox dentistry, there is no way in hell you can tell what's going on in there until you section that thing and find out, culture it and everything like that.
Right.
Well, we have a way of being able to determine that before the surgery is done. And it just doesn't seem to be able to communicate to them.
And that way is?
Other way is say, look, I feel there's a problem here. Go ahead and take the thing out and culture it.
Right.
And sometimes you have to argue with them to get them to do it in the first place.
Who's that?
The oral surgeon.
Okay. But your way of finding out is the,
Okay.
Okay. I just wanted to make sure that I was with you. That's what I thought you meant. Okay. Anyone, somebody else mentioned over here that they had referred? You have, Dr. Anna?
Yes.
And what was your experience?
No, you talk to them on the telephone and they're generally the only ones you talk to are the ones that confirm what your diagnosis is. Some guy's going to say, well, he's crazy and that shouldn't be. He's not going to call you or talk to you or not let it be known that he wants to, or you can call him back or whatever. See? And generally the patient will go along with it. And I mean, I haven't had a lot of problems with that.
You see, my whole thing is, I think it's this going the front door fear. If you take a look, I don't know if you've been to cocktail parties with other dentists, the orthodox dentists, but there aren't that many dentists who are out there who are really brash. I mean, you know, people who are going to want to stand in front of a speaker or a radio station. I view, and I've read a couple sociological books about dentists, not necessarily just the typical run-of-the-mill dentist. They don't end up being the most dynamic, outspoken people. They're usually quiet. Even physicians are the same way. You go to a physician and how they feel about fluoride, if they aren't quite sure or they are slightly for it or slightly against it, they really don't want to talk much about it. I've spoken in front of lots of them. I mean, I would love to get some of these people come out and speak about it, but they're very, very shy. There are only a few troublemakers. That's been my experience. Now, maybe yours is different. Maybe I've only seen a small section of these people. So I don't think you're going to get quite the flack that you think you'd get.
Well, it doesn't take too many. I had, there was one patient that I referred out to, went to 3 physicians. And all 3 of them all 3 said, I don't know what this therapy is, I've never heard of it, it sounds like quackery and lunacy to me. And so the